Are sky-high health insurance costs draining your wallet? You're not alone. But here's the good news. Millions of Americans qualify for free or low-cost health insurance and don't even know it. Whether you're a student, unemployed, a parent, or over 65, there are options tailored just for you. In this video, we'll break down 7 legitimate ways to get affordable or even free health coverage in 2025, and where you can find help right now. Finding affordable health coverage is essential, especially when medical expenses add up quickly. Between monthly premiums, deductibles, co-payments, and co-insurance, the cost of healthcare can be overwhelming. However, having health insurance helps reduce these expenses through cost-sharing benefits and negotiated service rates. If you're eligible for government-sponsored programs, Affordable Care Act plans with subsidies, or certain alternative options, you may be able to access free or low-cost health insurance that meets your needs. Here are 7 reliable ways to find free or low-cost health insurance and reduce your healthcare spending. The Affordable Care Act marketplace is honestly one of the most accessible ways to find free or low-cost health insurance. Available through both federal and state platforms, ACA plans offer premium tax credits, commonly referred to as premium subsidies, that can really help reduce your monthly insurance costs. Now, your eligibility for these savings depends on your income and household size. The ACA marketplace also offers specific options for young adults, and in many states, Medicaid has expanded to cover individuals with higher incomes, details which we'll discuss a bit further below. Medicaid is a leading option for those seeking free or low-cost health insurance based on income. As of December 2024, nearly 79 million Americans were enrolled in Medicaid or the Children's Health Insurance Program, or CHIP, making it the largest provider of health coverage in the United States. Medicaid is jointly funded by federal and state governments and is administered locally by each state, Washington, D.C., and 5 U.S. territories. Applications can be submitted through state Medicaid agencies or automatically forwarded from an ACA application if eligibility is detected. Coverage is available to a wide range of individuals, including pregnant people, children, parents, seniors, and individuals with disabilities. Emergency Medicaid may also offer limited coverage to undocumented immigrants, particularly for emergency room services. Eligibility is primarily based on income, household size, and other state-specific factors. The Children's Health Insurance Program, or CHIP, is a valuable source of free or low-cost health insurance for families with children. As of December 2024, over 7 million individuals were enrolled in CHIP. This program is specifically designed for children and families who earn too much to qualify for Medicaid but still cannot afford private insurance coverage. In many states, CHIP also provides coverage to people who are pregnant or have recently given birth. Coverage options and eligibility rules vary by state, but CHIP typically includes benefits such as doctor visits, dental care, prescriptions, and immunizations, all at little or no cost to qualifying families. So, a high-deductible health plan, or HDHP, is another option that can offer low-cost health insurance through reduced monthly premiums. These plans are available through some employer-sponsored benefits and also the ACA marketplaces. Now, while HDHPs require higher out-of-pocket spending before your coverage actually kicks in, they often cover in-network preventive services, like annual checkups, vaccinations, and health screenings, without needing you to meet the deductible first. For 2025, HDHPs have a minimum deductible of $1,650 for individuals and $3,300 for families. The annual maximum out-of-pocket cost, not including your premiums, is $8,300 for an individual and $16,600 for a family. HDHPs can actually be paired with health savings accounts, or HSAs, which let you save tax-free dollars for medical expenses. This can offer you some additional savings, which is pretty helpful. Having a high-deductible health plan also makes you eligible to open a health savings account, or HSA. An HSA lets you deposit pre-tax money to cover qualified medical expenses, and that can really help lower your healthcare costs even further. Some employers offer and manage health savings accounts or HSAs for their employees, but individuals can also open an HSA independently. In addition, catastrophic health plans fall under the high-deductible health plan category and are designed to provide low-cost health insurance that protects against very high medical expenses from serious illnesses or injuries. These plans have lower premiums but high deductibles, and, well, they're only available to adults under 30 or adults 30 and over who qualify for a hardship or affordability exemption. 5. Medicare with Extra Help. For individuals enrolled in Medicare, the Extra Help program offers a way to receive free or low-cost health insurance benefits related to prescription drug coverage. Extra Help is a federal subsidy for Medicare Part D beneficiaries with limited income and resources. So, in 2025, most people who are enrolled in Extra Help will pay $0 for their monthly premium for Medicare Part D and $0 for their drug coverage deductible. Plus, you won't pay more than $12.15 for brand-name medications and no more than $4.90 for generics. Eligibility is open to folks living in all 50 states and, Washington, D.C., and just so you know, there are other assistance programs available in U.S. territories like Puerto Rico, Guam, the U.S. Virgin Islands, the Northern Mariana Islands, and American Samoa. You might automatically qualify for Extra Help if you receive both Medicare and full Medicaid, so that's being dual eligible. Or if you get Supplemental Security Income, also known as SSI. And finally, if you qualify for a Medicare Savings Program, you're good to go too. If you don't qualify automatically, you can apply for Extra Help through the Social Security Administration. Just keep in mind this application is only for the subsidy and does not actually enroll you in a Part D plan. Medicare Special Needs Plans, or SNPs, are a type of Medicare Advantage plan that offer free or low-cost health insurance to folks with specific healthcare needs. SNPs are set up to provide customized benefits, care coordination, and reduced out-of-pocket costs for eligible enrollees. There are three main types of SNPs. First, there's the Chronic Condition SNP, or CSNP. This one is for individuals diagnosed with chronic conditions such as diabetes, dementia, heart disease, or other qualifying illnesses. Next, we have the Institutional SNP, or ISNP. This plan is for those living in nursing homes, inpatient care facilities, or receiving high-level home care. Dual Eligible SNP, or DSNP, is for people who qualify for both Medicare and full Medicaid. It offers comprehensive care with minimal costs. These plans are ideal for individuals who need more targeted support and, often come with lower out-of-pocket expenses and additional benefits beyond traditional Medicare coverage. One of the simplest ways to obtain free or low-cost health insurance if you're under age 26 is through a parent's health plan. This option is available regardless of your marital status, whether you have children, your dependency status, or where you live. If your parent has coverage through an employer-sponsored plan or an ACA marketplace plan, you may be added to their policy. In most cases, the additional cost of insuring you under an existing plan is significantly lower than purchasing separate insurance. Some states even allow you to stay on a parent's plan beyond age 26 if you meet certain conditions. Beware of low-cost healthcare offers that aren't insurance. When searching for free or low-cost health insurance, it's important to recognize that not every offer claiming to reduce your medical costs is actual insurance. Products such as healthcare sharing ministries, also called medical cost sharing programs, and non-licensed risk-sharing plans are not regulated like traditional insurance policies. These alternatives do not offer the same consumer protections, claims guarantees, or oversight by state insurance departments. If you're not getting your plan through an employer, the ACA marketplace, or a licensed insurer, be cautious. These unregulated programs may leave you financially vulnerable if you need extensive care. Where to find free or low-cost medical care without insurance. Even if you don't have health insurance, you can still access free or low-cost healthcare through hospitals, clinics, and community programs. These services can help with primary care, emergency care, and prescriptions for people who are uninsured. Federally qualified health centers, or FQHCs, are community health centers that provide affordable primary care services to underserved populations. Funded by the federal government, these facilities offer a sliding fee scale based on your income, meaning the cost of services is adjusted to what you can afford. According to the Health Resources and Services Administration, or HRSA, millions of uninsured individuals rely on federally qualified health centers for essential health care. You can use your zip code to find a nearby federally qualified health center by using HRSA's online search tool. Safety net hospitals and clinics, sometimes called county hospitals, public hospitals, or essential hospitals, offer care to everyone, no matter what your insurance status is. These institutions are honestly a critical resource for folks who don't have insurance, and they provide billions of dollars in uncompensated care every single year. If you're looking for one near you, just check your local listings or nonprofit directories that identify public or county health systems. Don't let high insurance premiums stop you from getting the care you need. Whether you're a college student, a low-income worker, or a senior citizen, there's probably a free or low-cost health insurance solution out there for you. So explore your options today through official sources like healthcare.gov, your state Medicaid office, or your local community health center. If this video helped you, go ahead and subscribe and share it to help others find affordable coverage too. And hey, let us know in the comments if you'd like a deep dive into any of these options.